Namaste viewers and friends, here I am with a new video and topic today, and today we are going to talk about the yoga therapeutic approach for sciatica, which we commonly known as lower back pain, but sciatica is a more intense condition than generalized lower back pain because it involves different anatomy and physiology. Apart from that, it is also quite complex. So we need to understand it to cure it properly. So today we are going to analyze sciatica. What is sciatica? What is the yogic approach for sciatica? Apart from that, the benefits of including yoga therapy for healing and curing sciatica and lower back pain in general, but specifically for sciatica. And also, what are the different asanas and pranayamas? What are the different contraindications, limitations and precautions people should follow if they are including yoga therapy for their sciatica treatment plan? So let's get started. But before we get started, I would like to request people who have just come to my channel and they are quite new, they started watching my videos recently, to subscribe my channel and press the notification bell so that you can get notified in the future, in the coming days and weeks, whenever I upload a new video. Well, sciatica is a disorder which happens because of the compression of the primary sciatica nerve. You can say it's a compression or irritation of the sciatica nerve. It is the longest nerve in your body, and it encompasses a range of symptoms affecting the lower back, buttocks and legs. So the sciatica nerve, which emanating from the lumbar and sacral spine, is the body's the longest nerve and plays a crucial role in transmitting sensory and the motor signals. Understanding the anatomical and physiological intricacies of sciatica is quite important for formulating the effective therapeutic yoga approaches. Well, what is a yogic approach for healing and curing sciatica? First of all, we need to understand the yogic approach. Yoga serves as a comprehensive therapeutic modality incorporating physical postures like asana, then controlled breathing patterns like pranayama and mindfulness, relaxation techniques to address sciatica. Rooted in the ancient wisdom, yoga promotes holistic well-being by fostering harmony between mind and body. Let's talk about some of the benefits of using or practicing yoga therapy for sciatica. First of all, it helps in a proper strengthening and stretching. Yogasanas such as backward bends and gentle twist provide targeted healing and stretching to the muscles enveloping the sciatica nerve, simultaneously building strength and also toning the adjoining back muscles. Sciatica can also originate from the hip region, which is specifically known as the piriformis syndrome, where the muscles in your hips can actually compress the sciatica nerve, and thereby you get radiating pain originating from the hip region going down towards the leg. It is very peculiar to understand that sciatica nerve hardly happens on both sides, but it can, in very rare cases, it can happen, but in 95 to 97% of cases, sciatica normally happens on one side of your body, either left or right, whichever body part is more susceptible for you, or they are chronic blockages. So it is also important to use yoga to open your energy meridians and chronic blockages. Well, the second most important benefit of practicing yoga therapy for sciatica is that it improves your posture. Normally, any musculoskeleton discrepancy or deformity would happen because of bad posture for a couple of years. Posture can be affected because of mental states, occupational issues. When you are sitting on your desk and working in front of computer whole day, probably your bed is not, your mattress is not good, and that is also creating some sort of blockages in your muscles and giving you a bad posture while sleeping. Apart from that, you're sitting, you're standing, and your work postures would primarily decide what kind of posture you would have overall in totality, because posture has a huge importance in yoga therapy, and one of the most important thing that we as a yoga therapist do is to improve the posture of our client or patient. So yoga's emphasis on body awareness and alignment aids in the correction of poor posture, a common factor in sciatica pain and lower back disorders. Poses focusing on spinal extension and alignment are included, such as mountain pose, which is known as Asana, which really facilitate the postural improvement. Another benefit is that yoga establishes that lost mind-body connection. We in the modern world practically are not connected with our mind and body. Our mind is racing ahead and his body is not able to cope up. We are expecting too much from our body, and we are subjecting it to a lot of torture and harassment, in the sense that we are going beyond our limitations and we are not aligned. So our mental demands are kind of passed on to the body, and body is not really good enough to cope up with it. So obviously we need to establish a mind-body connection. Mindfulness practices in yoga, including conscious breathing and meditation, foster a profound mind-body connection. By reducing stress and tension, individuals experience a holistic release positively. Let's talk about the therapeutic sequence for sciatica. I will start with the child's pose, which is known as the Balasana. Balasana is a restorative yoga pose where the practitioner kneels sitting back on their heels and extend their arms forward with palms resting on the mat. And this gentle forward bend promotes relaxation and flexibility in the lower back, hips and thighs. It creates a mild stretch along the spine, soothing tension in the sciatic nerve or region and fostering a sense of relaxation and muscular release. The next asana in the list is downward facing dog, which is known as Adho Swanasana. I would put a caution here: if you are in the advanced stage of sciatica and you've just got this flare up, I mean you are not able to move, you're on the bed rest, then obviously very limited things you can do. So in the initial stages of sciatica, probably you can just do hot and cold alternate compression, then you can put some ointments and massage, and probably rest a lot for a week. You might have to take painkillers in the initial 1 week to start with, and let the pain to subside and go down, because you cannot practice yoga therapy before a point, because movement needs to be allowed, and for that to happen your inflammation should go down a bit. So you might have to do rest, and then you start actually doing abdominal engagement where you do the abdominal pelvic tilts. I have not included those things in my session because that would require a separate session where I would actually explain you about managing sciatica within the first week. So this is basically an overall approach about sciatica, where we are assuming that you have recovered enough to start in the strengthening and toning phase, which is also known as the building phase, you know, where you are actually kind of coming out of it, but you're still there in between, and you need to reverse it. And so that you need to strengthen your muscles, you need to improve your flexibility, you need to calm your mind, and you need to be positive. Well, the Adho Mukha cannot be practiced in the first week, second week, probably for a month, but you will reach a stage when you can do a modified version of Adho Mukha, which I normally teach in my one-to-one yoga therapy client consultations and treatments. That's very important. Well, this asana involves inverted V shape with hands and feet on the ground. This foundational pose elongates the hamstring, stretches the entire spine and strengthens the shoulders and core. The core is quite important in this case, but there are other exercises in yoga for strengthening and building your core, which we can discuss in some other video, where I focus only on the abdominal core yogic stretches. But this asana does it in a grand way. The pose promotes overall flexibility and alleviates the tension on the lower back, offering relief to the sciatic nerve. Next is the Pigeon Pose. I also call it the Ek-Pad Raj Kapotasana. It might be quite intense for few people, so this can be practiced only probably after 2 or 3 months of the initial flare-up. Otherwise, you can safely practice the reclining, the Pigeon Pose, which I'm going to show in this demonstration here. Well, the reclining sleeping pose, you actually lie down on your back, and then you bring your feet close to your hips, actually, as you do in the bridge position. So that is the starting position for reclining pigeon pose as well, and maintaining a little bit of gap between the two hips by keeping the feet apart, aligning them parallel to each other, and your neck is properly elongated and no stress or tension on your neck or spine. Is quite stretched out and elongated, and your shoulders are relaxed and drop down on the floor. And then you basically raise your one leg and put it the shins of your as I'm showing in this demonstration, you put the shins on the basically just on the above of your knee on your thigh, and then you give a good stretch. You try to bring the stretched leg towards your chest, and then you give a good stretch. You stay there for a minute or whatever is your capacity, and then you release it and you repeat it with the other leg. Well, this deep stretch targets the hips and the glutes, releasing tension in the piriformis muscles, which can contribute to sciatic discomfort. The pose enhances the hip flexibility and aids in the overall alleviation of sciatic pain. The next amazing asana is cats and the cow pose. I also call it a Bidalasana. The names are controversial because in different classic books you will find this asana with different names, but I call it cats and cow stretch pose or Bidalasana. The cats and cow stretch pose involves a rhythmic flow between arching and rounding the spine while transitioning between the Marja asana, which is cat pose, and the Bidalasana, which is the cow pose. The dynamic movement promotes spinal flexibility and massages the lower back, stimulates the spinal nerves. The undulating motion helps releasing tension, making it an effective asana for sciatic pain and condition. Well, this asana is one of the best asana for sciatic pain. In fact, you can start it immediately after a week, just after the initial flare-up, which is the bhujangasana or the cobra. Obviously, you do the modified version of cobra in sciatica and not the full one, because it might not be possible for you to extend your back and come up all on your arms like a cobra, which looks very good, but it still needs your spinal flexibility and strength, which you might not have in sciatic inflammation, because rest of the muscles are also locked down. So basically, you need to do a modified cobra pose. So this cobra pose is actually an amazing back bend, which is in the form of extension while you're keeping your pelvic on the floor, and then you use your arm strength and align your elbows close to your chest, and then you inhale and you come up and you stretch your neck a little bit up, open your chest from the front, and give a beautiful and nice extension to your spine. Do not raise your hip or you from your toes. Keep it there rested on the floor, and then you breathe in and out slowly for a couple of times. This asana, this back bend strengthens the muscles along the spine, alleviates the stiffness in the lower back, and promotes flexibility. Regular practice of cobra can contribute to the reduction of sciatic pain. This asana itself can reverse your sciatic pain, but you have to do it dynamically, which I cannot show it here, but it depends on case to case actually. So you must include this asana in your sciatica treatment yoga therapeutic plan. Shalambhasana or the Locust, I would not recommend this asana unless you are feeling really comfortable, your body speaks to you, and you must practice all these asanas under the supervision, physical supervision and guidance of a trained and experienced qualified yoga therapist only, or a physiotherapist. Normally physiotherapists won't be able to help you out so much because they don't have elaborate knowledge of yoga, but in the initial stages you might need physiotherapist, and then later on you can engage the yoga therapist so that sciatica never comes back to you. Shalambhasana can be done in a modified way, but it could be very intense for your lower back. So obviously this asana would be recommended on case to case basis. But Shalambhasana is a prone back bend like a bhujangasana, with the difference that you also try to lift your legs keeping in a boat position, which is also known as this is a modified Shalambhasana, which is kinds of form of a very concave boat kind of a thing, where the practitioner actually lift the legs and upper body off the ground. Well, this posture targets the lower back, buttocks and hamstrings, strengthening the entire posterior part of the chain. And Shalambhasana is beneficial for individuals with sciatica as it engages and tones the muscles around the sciatic nerve, aiding in pain relief. So it is an amazing strengthening asana. If you have undergone through sciatica a couple of months back, then this is the asana you want to stick to, because this would make it sure that your pelvic region gets aligned with your spine nicely and your muscles get strong and your core becomes strong as well. So it works on your core as well. Well, next is the pawanmuktasana, or the wind relieving pose. It actually removes the vata and the apan vayu from your system, but this is not the reason I'm explaining it here. Of course, the sciatica would happen because of vata aggravation as per Ayurveda, but this pawanmuktasana asana is basically asana which I would recommend somebody in after right from the within 10 days of sciatica flare up, initial flare up. Because this asana is amazing, but still you need to go through a consultation with a therapist and physiotherapist. If they say okay, go ahead, practice, then only you should do it, because it can still be intense for some individuals in the initial stage. So pawanmuktasana involves lying on the back and bringing one knee up at a time towards the chest, while holding your the bent leg with just below the knee with your two hands, kind of interlock position. This pose engages the lower back, hips and thighs, providing a gentle compression that may alleviate sciatic discomfort. It also aids in the releasing gas from the digestive system, as I said, contributing to overall digestive health and the sciatic pain relief as well. Well, the next amazing asana in my list for sciatica treatment would be the bridge pose, or known as Setubandhasana. Setubandhasana is a back bend where the practitioner lifts the hips towards the ceiling. This pose engages the glutes, hamstrings, lower back, strengthening the muscles and support the spine. The gentle stretch across the hips and the lower back can be beneficial for individuals with sciatica, promoting flexibility and reducing tension in the sciatic region. Well, you should also include the shavasana, because relaxation is very important. Whatever healing happens in our body happens because of relaxed state, and we must try to induce the relaxed state as much as possible if we are in the healing phase. Otherwise, we will only frustrate ourselves and go through all the pain and misery and delay our healing, which nobody wants. So always include the relaxation techniques. This video is not about relaxation techniques, but at least you can do shavasana, which is a corpse pose at the end of the sequence, or maybe during 2 or 3 times in a day if you feel tensed and if you feel like suffocated and you feel like your muscular tension is increasing. So just by practicing shavasana, corpse pose would help you to relax your muscles and your lower back region, and the pain would go down on the scale of out of 10, it would go down by at least 3 points. So if you were on 9, then you would go all of a sudden you will go on 6.5 to 7, which is still a bonus. So practice shavasana. I'll teach shavasana in some other video, but you can find so many videos on internet, but do not imitate anything from internet. This video is only for information, with a disclaimer that do not start practicing these asanas just because I am showing you here. I'm not really recommending that. You should do it under the guidance of a skilled, qualified and experienced yoga therapist. So let's talk about pranayamas now. Which pranayamas you would like to include if you're going through sciatica? Well, my first choice is Nadi Shodhana pranayama, but before Nadi Shodhana you can just do yogic breaths, which is also known as a diaphragmatic deep breathing, where you inhale and you expand your abdomen, you expand your chest and you expand your clavicle, which is a region close to your collarbone or the breastbone in women, and then keep doing this, like inhale, expand and exhale, release. You don't have to contract while releasing, you just have to expand. It means you need to breathe from your stomach. How many people actually breathe from your abdomen? You can check throughout the day, just sit, relax and sit back, release all the work and observe your breath. Are you breathing from your abdomen? No. So we need to learn to breathe from abdomen, then we would get more prana. After practicing this diaphragmatic or yogic breath, you can go to Nadi Shodhana pranayama, which is also known as the alternate nostril breathing. Nadi Shodhana pranayama involves controlled breathing through alternate nostrils. This technique balances the flow of energy, reduces stress and enhances respiratory function. But the most important aspect is it cleanses your Ida and Pingala Nadi and basically It cleanses all your 72,000 nadis within the body and cleans and clears your pranic energy meridians. In that way, it really helps in curing all the diseases, not just sciatica, but of course sciatica as well. The calming effect of this pranayama contributes to an overall sense of well-being, complementing the physical postures which you have been practicing for sciatica. It will also relax your mind and your nervous system, which would actually expedite your healing. The next pranayama that I rate quite high actually for so many disorders, but in general as well, is Ujjayi pranayama, which is also known as victorious breath. With my years of practicing this pranayama, I can safely say that this pranayama gives you a lot of prana. This pranayama actually kind of opens up the subtle energy channels and also give a mild stimulation to your Mooladhara and Swadhisthana chakra. Also Anahata chakra, if you focus on your third eye or the Ajna chakra with the vibration or the sound of the vibration which your breath makes through your throat, like a hissing sound. So Ujjayi pranayama, or the victorious breath, involves breathing with a slight constriction in the throat, creating a soft audible sound. This technique enhances concentration, promotes relaxation, and supports mental focus. Ujjayi can be beneficial for individuals managing sciatica, providing a mindful element to the practice. And you can also practice this breath during your asanas or in general during meditation, while meditating and focusing on your breath. Of course, practice Shavasana after any sequence. You can practice Shavasana without practicing sequence as well. It's a very good relaxation technique, which I already mentioned, but please end your practice with Shavasana at least 10 minutes. This would really enhance the effect of your practice to probably many folds. Let me talk about the contraindications and modifications. I won't focus too much on modifications, but more on the contraindications. But I would come up with a separate video in the future for lower back and sciatica, where I would actually show the asanas, how you can modify certain asanas if you are going through sciatica. But again, I say it's case to case. Nothing is standard. Yoga, Ayurveda is quite case to case. It's not generic. Well, first you should consult with a healthcare professional. You should know that you have a sciatica, because there are so many disorders going on in the back which can result in sciatica kind of a pain. Temporarily, but sciatic pain is quite peculiar and distinctive in a way that it radiates down the leg. So if you have a pain which is radiating down to your either left or right leg from your hip or from your lower back, then you have a sciatica. If it is radiating from your lower back, you might have a disc bulge or herniated disc in the worst case, which would need a lot of care. You really have to be careful if you have a disc bulge or herniated disc in the worst case. But if you have a piriformis syndrome, which is pain radiating from your hip, your glutes, down to your leg, then you have piriformis syndrome, which is also complicated but can be healed easier as compared to the herniated disc. Well, in either case, you should always consult a professional healthcare practitioner or yoga therapist, physiotherapist as well, and then make a proper diagnosis that it is a sciatica. And I don't recommend people to go for CT scans or MRI, but if it is recommended by your healthcare practitioner, then you might go for it. Although I don't recommend, clinical diagnosis could be enough to find out if it is sciatica or if it's a different kind of a back pain. And you should also ascertain the limitations by having a meeting with a certified or registered yoga therapist or a physiotherapist, which I call a physical therapist as well, and then understand what is your condition and what is the range of your movement. They will help you to identify your condition, what is the range of your movement, and what other things you should do along with yoga therapy, like hot and cold compression, or there are some techniques that you might have to go for to get some relief, and then come out of it. Make yourself mentally prepared that, okay, I have got this sciatica condition and pain, and I have to reverse it. Prepare yourself mentally, come out of all the negativity, everything can be healed. Your body has a tremendous, amazing ability to reverse everything and heal you. But you have to use that force within you by your positivity and optimism. Always adopt a gentle approach. Aggression is not a part of yoga culture. I'm not talking about the distorted yoga culture coming from West. I'm not even saying that everybody practicing yoga in West are distorted. No, but there is a brand of yoga which is quite aggressive, which primarily originated in West, not in India. So I have to mention it. Well, aggression is not a part of yoga therapy. If you are going into yoga therapy, do not be aggressive. You have to be very gentle and very restrictive, very restorative. So modifications to poses would be there. Even if you can stretch more, you would be said not to do so that you don't get injured, because at any stage you can go backward in your healing journey. That is the reason you should not do it yourself, right? That is the only reason, because you don't know what's going to happen if you go beyond this particular limit in your asana practice, or if you do a lot of pranayama, if you start doing kapalbhati, you might aggravate your sciatic more. So be gentle. Modification to poses should prioritize a gentle approach, avoiding aggressive movements. Gradual progression is a key to preventing sciatic pain further, and also try to heal it and reverse it. You should avoid forward bends, because forward bends would actually, especially if you have a disc bulge or herniated disc, then you should definitely avoid forward bends, because that's going to pop out your disc from the intervertebrate disc and would compress your sciatica nerve more, and you would go really bad in your pain. So complete no to forward bends like Paschimottanasana or Padhasthasana, or standing forward bends or sitting forward bends are more intense though, but you should avoid it at least for 3 to 4 months. But in the future also you have to do it very carefully once you got sciatica. Okay? Mind you well, I'm saying if you got it from, you should avoid forward bends if you especially got it from the lower back, which is basically disc bulge or herniation. If you got it from your hip region, piriformis, then also you should avoid it, but there are a few exceptions. Apart from that, you should also be very mindful. Whenever you are practicing any asana, make sure that you are very mindful of your pain threshold. So there is a threshold beyond which you cannot go. You can touch your threshold, but you can come back. And that is the awareness you need to have. Your therapist, your physiotherapist or yoga teacher, therapist would not know what is your threshold, because he or she cannot feel within your body. You can feel it. So you have to communicate, you have to be aware. You have to communicate well with your therapist, you have to communicate well with yourself first and find your pain threshold. Do not set a target. Okay, healing doesn't happen with a target. Yoga doesn't happen with the targets. You have to let it go. You have to bring the nature into the play and let the nature do its part. Okay, so if you are gentle, if you are communicating with your body, if you're aware and conscious of your body and pain threshold, then definitely yoga therapy is going to work for you. Otherwise, it's going to kill you. Basically, it's going to reverse it. Yoga is not meant for people who are aggressive. So first, calm yourself down, hold your horses, trust yourself, trust your therapist, and trust the nature. Okay, and then you will be healed. So in the conclusion, I would say that yoga therapy is a very effective way of treating sciatica. I've personally treated many patients in the last 12 years of my practice as a therapist and as a teacher. I give one-to-one consultations. So if in case you are suffering through sciatic pain or lower back pain or any other disorder, I mean, I have a list of disorders. I'll put the link in the description where you can go on my webpage and read about it, or maybe you can watch my other YouTube videos and understand what basically I do. I am a holistic health consultation. I treat patients with chronic disorders, different chronic disorders, not just sciatica, with the help of Ayurveda, diet, herbs, and yoga therapy. So let me conclude it that yoga therapy is a very effective way of treating, managing, and curing your sciatic pain and condition. It includes the target asana practices, which forms a potent strategy for managing sciatica. By delving into the nuances of specific poses and incorporating mindful breathing like pranayama, like Nadi shodhana or Ujjayi, individuals can really embark on a journey toward not only alleviating sciatica pain, but also fostering a comprehensive sense of well-being, which is very important, because you should also feel that you are healing. You should also get other benefits from the sequence of sciatica pain relief, not just sciatica, because everything is connected, everything is holistic. sciatica pain would happen for different reasons because of your emotional and mental stress, your poor posture, which would happen because you were emotionally stressed. And emotional stress can do a lot of damage to your body, also your cardiovascular system, your heart health, a lot of other things. This video would become too long. It's already got too long here. So nonetheless, personalized guidance and informed approach remain paramount for safe and effective integration of yoga into sciatica. With this thought, I would leave you now. We reach end to this video here, and once again I repeat, if you have not subscribed my channel, then do subscribe and like, and if you like enough, then also share, because this knowledge should go to as many people as possible, so that people can include yoga therapy in their treatment plan as well, along with conventional treatments, which are basically quite ineffective in curing sciatica, because yoga targets your emotional, mental states. Yoga targets the root cause. Yoga is non-invasive, non-aggressive, and also steady and slow approach. That's how the healing happens in our body. So I leave you with this beautiful thought. I'll see you in the next video. Until then, take a very good care of yourself. Namaste.